A warm welcome to everyone, and thanks for joining us today. This is the first of a two-part series called Pathways to Inclusive Social Protection, organised by the Australian Government's Department of Foreign Affairs and Trade in partnership with UNICEF and hosted by socialprotection.org. We're hoping to explore how inclusive and gender-responsive social protection systems can be designed to support those most at risk of exclusion and insecurity. Rooted in the Asia-Pacific context, offering globally relevant insights and guided by gender equality, disability, and social inclusion principles, the series highlights integrated, people-centred approaches that address barriers faced by persons with disabilities, women and girls, and other marginalised groups. So I'm your moderator today. My name's Felicity O'Brien, and I work in the social protection section in the Australian Department of Foreign Affairs and Trade. So just some housekeeping before we get started today. This session is going to be recorded, and along with the presentations from all our guest speakers, the materials will be available, including the recording, on the socialprotection.org website after the event. Please use the chat box to introduce yourself, and if you have any useful links to share, then you can share those to the rest of the group via the chat box. We, as you can see, have our international sign language interpreters working very hard for us in the background today. They should be spotlighted for the entirety of the webinar. And if you need to use the closed captions, down on the bottom of your screen on the right-hand side is the closed captions button that you can press to have those come up on your screen. So after our guest speakers have all had their chance to do their presentations, we'll have a question and answer session at the end of the webinar. So please, if you do have any questions for our speakers, please put them in the Q&A box, not in the chat box. Please use the Q&A box. And it's also really helpful if you put your name and organisation in there and some context around your question and who you might be directing it to. So let's get started. So in today's webinar, we will explore how various components such as identification and assessment of disability support needs, Cash Plus programs, universal health coverage, and care and support services can work together to enhance inclusion and participation for people with disabilities and their families. We'll examine the scale and potential pathways for financing such approaches, both for governments and development partners. Our guests will highlight country experiences in developing integrated support, and we hope the discussion adds a valuable contribution to the growing body of knowledge on effective multisectoral strategies for disability inclusion, particularly in the social protection sector. So social protection is not just a safety net, it's a powerful tool for inclusion, dignity, and equality. Inclusive social protection is essential to ensure people with disability are not living in poverty and can access essential services such as healthcare, education, employment, and independent living. Inclusion is not automatic, and when we design with accessibility and equity in mind, social protection can reduce insecurity, support resilience, and open doors to education, employment, and community life. This year, DFAT released our International Disability Equity and Rights Strategy. You can find a link to it on the sp.org website or on our DFAT website. In this strategy, following an approach endorsed by many of our OPD partners from the region, the strategy highlights the 6 preconditions or key enablers to equity and participation. Those 6 elements are accessibility, assistive technology, support services, social protection, community-based inclusive development programs, and non-discrimination. In today's webinar, we will hear examples of the precondition approach in action and experiences supporting inclusive multisectoral approaches. We're joined tonight by some esteemed guests. We have our UNICEF colleagues, introducing Social Policy Specialist Alex Cote and our UNICEF consultant Charles Knox Vydmanov. From Thailand, we have Nantanut Suwananawut, who is the director of the International Cooperation Section from the Ministry of Social Development and Human Security. And we also have Faatino Utumapu, who is the General Manager of Nuana Ola Laofa, or NOLA, who are the disability advocacy organisation in Samoa. So thank you for our guest speakers joining us tonight. And I'll now hand over to Alex from UNICEF as our first speaker. Over to you, Alex.
Thank you very much, Felicity. And it's a pleasure to be again in a collaboration with DFAT for such webinar. To start this discussion, we would like to come back to one of the foundation of inclusive social protection, and in a broader way, inclusive policies for persons with disabilities, namely, how do we address disability-related costs that children, working age adult, and older persons with disabilities and their families are facing across the life cycle. So, if you have been in several of those webinars, you are quite familiar with the story related to disability-related costs. Basically, the fact that persons with disabilities and their families spend more and earn less. They spend more because of disability-specific expenses, such as personal assistance, assistive device, rehabilitation, or modification, but they also spend more on general items, on healthcare, on transportation, or housing. In addition to those additional expenditure they face, they also have fewer employment opportunities because of fewer educational opportunities, which leads to much more difficulties in accessing employment, also because of discrimination and barrier in the labor market. And that leads to lower income of persons with disabilities. Additionally, for people with high support needs, very often parents of children or family members of working age adult and older person will have to forego educational opportunities or work to provide care and support. Very often, and we know that the majority of this unpaid care and support is provided by women and girls, contributed to the overall gender inequalities in care economy. So I think we are all clear with the fact that disability arises from the interaction between persons with impairment and an environment that can be either with significant barriers that needs to be removed, or more or less support that needs to be provided. And this interaction basically will produce more or less possibilities and opportunity for social participation for persons with disabilities. So if we want a framework that addresses disability-related costs and promote inclusion, we basically need to remove barrier and provide support. And we articulate here the key element, the precondition that Felicity was mentioning: accessibility, awareness, non-discrimination, inclusive services. We remove barriers. But in addition to that, we need to provide the support that people require to seize the opportunities that are available in the community. And that could be personal assistance, sign language interpreters, supported decision-making, assistive technology and associated rehabilitation, and a set of benefits that would help further address disability-related costs. Of course, considering the vast diversity of persons with disabilities in terms of age, type of support they need, and type of barrier they face, it is absolutely crucial in the design of any of such policy or intervention to have meaningful engagement of the diversity of persons with disabilities. So here I would like to take an example that was shared with us a few years ago by a colleague from Thailand with regards to his transport cost. We know that for many people with disability, transport is a significant source of disability-related cost. And he was sharing with us that in 2010, because most of the public transportation was not accessible, he had to use a lot of taxi. And this taxi would cost from around 300 to 400 US dollar a month, which in most of the time was unaffordable. But in a decade, there has been so much more station for tram and public transport that have been made accessible, which made his transport and his journey to go to work, for instance, much easier. In addition, with the Thai disability card, there are benefits in terms of concession and reduced costs, such as free ride, for public transport. And the combination of those environmental intervention on accessibility of public transport plus social protection intervention in terms of concession, and we could refer also to the disability allowance in Thailand. We will hear more about it in a minute with our colleagues from Thailand. But that reduced tenfold, basically, the costs that he was facing with regards to transport. And this is really a virtuous circle of inclusion that providing support and removing barrier policies and intervention basically seek to create. By providing support to a person with disabilities, we provide the elements that they may need to immediately engage. By removing barrier, we make the community more aware, more welcoming to this participation. And it takes time. And it doesn't evolve at the same pace for different groups of persons with disabilities. We know, for instance, that some person will need higher support and will face higher discrimination and higher barrier in the community, sometimes with regards to accessibility, sometimes regarding to attitude. But what is clear is that the combination of provision of support and barrier removal promote greater participation of persons with disabilities. And when there is more participation, there is more confidence for persons with disabilities that will therefore engage further. There will be more confidence of families that maybe will be more open to let persons with disabilities, including children, to take more risk and engage in the communities. For communities themselves, the more visibility and participation there is for persons with disabilities, there is more awareness about what are their needs, what can we do, and what are the benefits for the community of having greater participation of persons with disabilities. So when we talk about addressing disability-related costs, we are talking about a co-production between state intervention and community mobilization. And the aim of state intervention is to fuel this virtual circle of participation in the community. We don't have the time today to go in detail about giving a panorama of the situation with regards to those different preconditions. So I would like to refer to the Global Disability Inclusion Report, which we produced together with several UN agencies, the International Disability Alliance, the International Disability and Development Consortium. You can scan here to get to the landing page, and we will paste in the chat the link in a minute. But basically, we did an assessment of where do we stand with regards to those different preconditions. We looked at non-discrimination, awareness, and awareness raising. We looked at legal harmonization towards the Convention on the Rights of Persons with Disabilities, and how non-discrimination was taken into account. We looked at accessibility, assistive technology, inclusive services in health, education, employment, for instance. We looked at care and support system, and of course, we looked also at social protection. We looked also at the issue of financing, and Charles will tell us a little bit more in his presentation. So one thing that is really important is that when we look at barrier removal, it takes a lot of time. Removing barrier in terms of accessibility, ensuring that any new infrastructure or facilities is accessible, or that we retrofit existing systems, websites and facilities and infrastructures, take decades. Any progress is a good progress, but it takes a lot of time. Shifting attitude takes time. It takes sometimes generation. Any progress is a good progress, but it takes time. So while those transformation of the environment takes place, social protection has a crucial role to play to address the cost of disabilities and to finance efforts of persons with disabilities to overcome the barrier they face and compensate the functional limitation they may have by providing basic income security, universal health care coverage, including early intervention, rehabilitation, and assistive device, as well as coverage of the broader disability-related costs, including access to gender-responsive community care and support services. So if we look at healthcare, the broader set of disability support services, education, early childhood intervention, housing, energy, public transportation, livelihood, and employment, and you have the core of the social protection system in interaction, you have a universe of possible benefits and services that social protection can either directly provide or support the development of, or enable, or contribute to, or complement. And that will be very different in different countries. But it's very important that we look social protection system in their entirety, and we really seek to maximize the possible interaction and complementarity between the social protection system and the diversity of sectors, schemes, programs that exist led by different sectors at the central and local government. To conclude, one thing that is extremely important is that if we want to be able to support persons with disabilities and to address this diversity of cost, considering the diversity of persons with disabilities, it is very important that the way we identify persons with disabilities for the purpose of targeting social protection also include disability needs assessment. Not just, are you a person with disability? Yes, no. What kind of disability do you have? We really need to know what kind of support you need for eligibility determination, for case management and referral, but also for broader policy planning at local and national level. If we want to direct regulatory mechanism, financing, service delivery arrangement, innovation, workforce development, so that we provide the most efficient and effective cash transfer, transportation and housing, assistive technology, human assistance and support, and as well as interlinkage with all other services and programs we talked about, these needs assessments are really essential. One key element that we saw across sector and across countries is the fact that most low and middle income countries struggle to reach scale. And a big reason for that is financing. So we will hear in a minute with Charles about it, but it's really important that as we develop our policy framework, we put much more emphasis on the way this will be resourced by a combination of public intervention, community mobilization, and private sector, but getting a sense of the scale is essential. Thank you very much.
Thanks so much, Alex. I'll hand over now to Charles, who is going to talk to us about financing social protection.
Thanks very much.
Thanks.
I just noticed that, oh no, it's okay. It was taking a while to come up with the option to share, but let me just do that now. Okay, hopefully you can see the screen. It's great to be part of this this conversation, and looking forward to interacting with all of you. So yeah, as Alex said, what I'm going to do for the next few minutes is just provide a couple of insights on this question of integrated support, but focused on the financing side, based on some analysis that we conducted as part of the Global Disability Inclusion Report 2025. So I want to look at a couple of things. First, well, what are the patterns of expenditure currently in terms of expenditure on disability? And then to consider a couple of points of it when we're thinking about engaging in processes to finance programs and services that support disability inclusion, what are some key things to keep in mind? So first, talking about the scale of expenditure and how much is being spent so far. So in the development of the report, what we wanted to do was start to fill what is really a big gap in terms of information on how much countries are spending on disability inclusion. There has not really been very much analysis to date across countries of the level of investment, and it's quite tricky to do. But what we've managed to achieve was an analysis of 14 low and middle income countries. And what we did for that was focus on, so just 1 second. The way, the approach that we took was really to undertake analysis of budgets, and this was done in collaboration with a number of different partners, and look specifically at budget lines which were focused specifically on disability in one way or another. Now, there are challenges there. This approach can underestimate disability expenditure, maybe because some budget lines, some activities are not well captured by the budget. Equally, because disability is combined with other expenditures, say rehabilitation for people without disability as such, it may potentially overestimate the expenditure. And also we have a bit of a challenge. We're pulling out budget lines, but we're not doing an analysis of how inclusive those expenditures necessarily are relative to the CRPD. However, the analysis does come up with some interesting trends about where countries sit. What this chart shows is that the range among these countries is an expenditure of really quite low levels of around 0.01% of GDP, all the way up to, in the case of Argentina, 0.8% of GDP. So this is the kind of range we're seeing among low and middle income countries. And I think what we found is we could broadly categorize countries into 3 groups, which I'm going to refer back to a few times. Those that are spending less than 0.1% of GDP. We can consider this maybe an initial level of investment in disability, where there are likely to still be quite significant gaps in provision of different kinds of policies. At around 0.1% of GDP, we tend to see countries that are starting to implement a kind of basic package of interventions. So this kind of integrated package we're talking about. And when we look at countries closer to 0.5% of GDP in terms of their expenditure on disability, here we're seeing more comprehensive programs across sectors, particularly in terms of social protection. So then moving on, this chart shows exactly the same countries and data, but looks at actually, well, what are countries spending money on? And what we find is in those countries with a kind of initial levels of expenditure, in the end, what we're seeing is quite limited expenditure across a range of different sectors. However, in those countries that we see that have made greater investments, those spending 0.1% of GDP or more, those slightly higher spending countries, social protection is really the main driver of that, and is the main component of that expenditure. Now, I think that reflects, as Alex was explaining, the impact that social protection can have, and particularly how it can help address many disability-related costs and barriers that people with disabilities face in the context that other reforms, say in terms of accessibility, inclusion across other sectors, may take longer to achieve. It is worth noting, it may also slightly reflect the challenges of tracking expenditure. Social protection tends to be a more obvious component within national budgets, whereas if we take an example such as healthcare for persons with disabilities is often not as captured as well in budget documents, for example. So there may be investments that aren't always well captured in other sectors. Just to kind of reinforce this message and this picture that we see in terms of the levels of expenditure on social protection, while we only have really those 14 countries that we've looked at in terms of a broad picture of disability expenditure, we actually have information on social protection, particularly disability, non-contributory disability cash benefits for a much wider range of countries. So this chart shows the level of expenditure, how much countries, a number of different countries, low and middle income countries, are spending on disability and on non-contributory disability benefits. And what we find is actually we're looking at a similar range of expenditures. We see some of those countries that have say, made significant investments in recent years to expand disability benefits, but are still on a bit of a pathway to do so, more of that 0.1% of GDP figure. Whereas those countries at about 0.5% of GDP in terms of expenditure, I think we can consider some of those countries with higher levels of coverage and adequacy. In fact, some of the more established schemes where we tend to see some of the strongest evidence of impact on persons with disability. You should just note, as is shown there on the slide as well, here we're looking at low and middle income countries. When we look at higher income countries, when we look at OECD data, those countries tend to be spending around 1.5% of GDP on average on social protection just for persons with disabilities of working age. So one might expect higher income countries to be spending significantly more. So that's a little bit of a picture in terms of the levels of expenditure and the fact that social protection tends to be quite a core part of that picture in countries that have expanded expenditure on disability. Now, one thing within this analysis we really wanted to highlight is in those previous slides, we've focused more on that sector level expenditure, particularly social protection, but also other key sector expenditure that may be captured better is around education, health, for example. However, we would argue there's a need for greater financing on some of the enablers or kind of preconditions for inclusion that don't sit neatly in one sector or in one ministry and need to be achieved by working really across government. So that can include systems that support sign language interpretation, which is something that various parts of government may be needing to draw on. Personal assistance, guide interpreters, supported decision-making, assistive technology, which classically can often be found within health, education, social welfare functions, accessibility standards, their development and enforcement, non-discrimination and reasonable accommodation, and also the systems that support disability assessment, determination, and certification. And really, there's a strong argument that there's a need for some kind of pooled funding mechanism between sectors, and also recognizing, across different levels of government, recognizing the role of local government, which can support these different functions, because otherwise there's a risk that either they're done in a fragmented way or they fall between the cracks. Now, one insight we wanted to flag from the Global Disability Inclusion Report was the potential role of disability funds, which we see in many countries, which are basically mechanisms by which certain resources, be they from the tax system or elsewhere, are earmarked or pooled into a fund that can be used for certain activities. Now, I think the key headline here is these may have a potential to fund some of those mechanisms, because again, they're working across government. They can perhaps provide a kind of recurrent, reliable source of funding. However, what we see a bit in the analysis is that while many countries have these schemes, often the objectives are not always that well defined, and the funding sources are also equally not always that well defined. So, while there's potential here, there's work to do to better design such funds to be more effective, including supporting these kind of activities. Now, just for the final part, we wanted to highlight what are more looking to the future, how one can engage in budgeting and the financing question. What are some key things that are really critical and important to be able to secure financing for this integrated package across sectors? Now, the first thing is really highlighting there's need for greater focus on understanding levels, tracking existing public expenditure, and also official development assistance. So part of that is, doing more, better national level analysis, building systems that more easily allow analysis of budgets and allow the kind of data that I shared before to understand how much are we spending and on what. And that includes looking at international cooperation, at ODA, and there is a whole discussion and agenda really about that within the Global Disability Inclusion Report, and it came out strongly within the Global Disabilities Summit about how we can better at national and international levels track international development cooperation expenditure on disability that supports disability inclusion. Another thing also, though, is not just looking at how much you spend, but how one can better plan and convert those different intentions of where we want to build better systems into actual budget commitments. And this highlights the importance of being able to assess the financing gaps and cost different kinds of plans for expanding different kinds of services and programs. That can involve costing of specific interventions, such as, say, a disability allowance. It can also, but also, I think, a kind of promising approach that to think more about is actually development to more comprehensive action plans, costed action plans, looking at disability expenditure as a whole. Now, a nice example of that that's recently been developed is in Mauritania, where the National Strategy for the Inclusion and Promotion of Rights for Persons with Disabilities included a costed action plan, and that was adopted just towards the end of 2024. And just to highlight, link to this, you know, the importance of this is to integrate this kind of information into annual budget formulation, but also some of that more kind of strategic planning, medium-term expenditure frameworks, broader national development planning, including integrated national financing frameworks, which are a kind of international tool which is being more used for that purpose. Now, just to put that into practice, think, well, what might it look like, some of the costing of the financing gaps? We did look at that also a bit in the Global Disability Inclusion Report. And the key headline is really to say that generally that costing is better established. We have better data, better methodologies on the social protection side. So in the report, we look at costing across 5 countries for cash benefits and subsidized health insurance for persons with disabilities. And we actually come up with a cost roughly around that 0.1% of GDP for some kind of priority national reforms in those countries. However, it's worth highlighting that actually, when we look at those other elements of a kind of integrated package, care and support services, inclusive education, assistive technology, healthcare systems, concessions, actually in that space, the tools, the methodologies, the data, the kind of service models that we're going to use to do that costing are, I'd say, often not as well developed. And so that's a real, I think, area for attention as when we think about how to cost those kinds of packages. So I'll leave it there and pass back to Felicity.
Great. Thank you so much, Charles. That was a really interesting presentation on the financing part of the story. Please, if you do have any questions for our guest speakers, you can start to put them in the Q&A box. We'd love to see some questions coming through. I'd like to hand over now to our 2 guest speakers who are going to provide some sort of country updates on the work that they're doing. So first of all, we're going to hear from Nantanut from Thailand. So over to you, Nantanut.
Madam Moderator, welcome everyone, and hello from Thailand. My name is Nantanut, also for Apple. Just for those of you who cannot see, and with the short hair, with the round face, with the white shirt, and the blue jacket. Okay, thank you so much, and it's my honor today to share about the social protection services and benefits and welfare of persons with disabilities in Thailand. Okay, first of all, may I start with a brief introduction of my organization, or the DEP, Department of Empowerment of Persons with Disabilities, well, and also with the overlook and with the overview of persons with disabilities in the country. Okay, and for the DEP, our mission, DEP actually is our abbreviation of our department. Actually, these that we work for development, right? Of course, to develop about the policy and legislation for persons with disabilities. We act as a national organization working in any dimensions, in any issues on disabilities matters. And we also empower persons with disabilities so that they can have skills and equal access to the rights, welfare, and facilities. And the last thing for participation and to strengthen organization of persons with disabilities and other sectors, because we cannot work alone, right? We have our partners to work together. And we also, especially for organization of persons with disabilities. And our vision, of course, to be the organization to encourage disabled to thoroughly to have an equal access to the services and facilities in the society and to have a full participation. Okay, and next. Here is an overview of persons with disabilities. Here, we categorize persons with disabilities into 7 types. Of course, like visual, hearing, intellectual, psychosocial, autism, right? Learning disability. For these categories, we work together, and it's composed around 2.2 million people, and half or 60% of which are persons who are elderly people. Of course, here is goes with the global trend, right? The more we getting into the aging society, the more we have persons with disabilities, and we have equal about the same between male and female. Okay, and this constitute about like 3.4% of the whole population in Thailand. So this is not like a small number anymore, and this number keep increasing day by day. So therefore, we need a good policy to take care of this group of people. And here is the mandate of the Ministry of Social Development and Human Security, that to enhance the capacity building of the people in any ages, like ranging from the children, working group, and also with the elderly people. We upskill and reskill them, and so that they can earn a good of good ways of living and to develop a quality of lives. Okay. The capacity building, and we also work with the friendly environment, with the ecosystem at the same time. And this is the policy for our department. We have like 5 mandates. First is to, as I mentioned, we empower persons with disabilities so that they can have like a good skills. And also we also work with to develop the disability, like the service system, to have so that they can have like a quality system so that it can capacitate their abilities. And we also looking at the rehabilitate them and to build a friendly and accessible environment, along with using the digital and innovation for the development. We have like the 3 flagships with the 3 mandates. First of all is to have the welfare, a good welfare, so that they can be empowered, right? And with to use the innovations as I mentioned. And second is to build a good mechanism, like to develop the career development centers, and also along with disability service centers which are located throughout the country. So these are the office, we work like decentralized area where they can help persons with disabilities in their local areas. And also the last one, to empower the personnel who work in the field, right? We have even both the personnel in the DEP ourselves, the personnel in the disability service centers. We have like over 3,400 centers throughout the countries. And also we work with the people, the volunteers, right? The ministry have the volunteers all throughout the country, and we trained them to be knowledgeable about persons with disabilities, so then that they can work with the people in that local communities. And here is about the social protection scheme. First, they need to be registered to be disabled people, and so that they can get the government benefits, right? And it's very easy nowadays since we digitalize the system, right? And we facilitate more system, like when they get to the hospital, they can be registered over there right away, because we work with the Ministry of Public Health, we work with the local authorities, so this can be easier for them to be registered. And once they get the card, and we also have the digital card in form of applications that it can verify them as a people with disabilities, they can earn these services. Like medical services, of course, rehabilitation, they can be examined, right? They can be getting consulted with the doctors and get full rehabilitation services, and to get medication consultation from the doctors, and without any charge. They can get the assistive devices and any according to their needs. And also they can get medical services, all types of they want, the way they want. And next is about the educational services or the service provisions. And apart from the auxiliary aids, right, that they can get, in the schools or for their lifelong learning, we provide like the free tuition, like first 15 years that they don't have to pay up to their first bachelor degrees. And they can get like the coupon that it can be exchanged for any learning materials or learning in instruction materials. And just now I talked about the free tuition, for they can get the first bachelor degree without any payment. These are some of the examples, like if they study in the social science, they get a certain amount of the support, right? And this varies by the different faculty. And the next services is to support with the employment. We, apart from like the promote employment here, we have the Act of Empowerment of Persons with Disabilities, which is the dedicated law, dedicated legislation for persons with disabilities. Particularly Article 33, 34, 35 that support the employment. For example, like 33 to direct hire person with disabilities. Here we use the quota system for 1%, right? For the companies or the companies who want to hire, they once they have like employees, for example, like 151 employees, they are required to hire at least 2 persons with disabilities, like because it's 1%. And otherwise, if they don't want to hire, they have to pay. They have to pay the levy, right? We have a certain rate and calculation formula for them, at least like the minimum wage multiplies by 365, which is the days throughout the year, right? And it's almost 200,000 baht per year, just in case they don't want to hire. And the money will go to the debt fund, the fund for empowerment of persons with disabilities. And if they want to hire, they want to pay, we have another option for them, which is the concession. They can either provide services to use the products, to provide the trainings, like the vocational trainings for persons with disabilities. They can provide the assistive technologies. They can build the accessible environment. You see, there are lots of options. They can provide the space, the place for persons with disabilities to sell their products, etc. So these are an option that government offer for them. Okay, so, and also we also promote for their self-employed in case that they don't want to be hired, right? They want to work independent. They want to work like on their own. They have to own their business. We have another option, which I will be presenting later on. And the last service is about the social protection in order to enable them to be independent in the society. We have the sign language interpretation services. For those who cannot hear or with the hard of hearing, they can come to, of course, they need to be registered, right? And we have a set of the sign language interpreter who are certified by our department. And this pool of the sign language interpreters are waiting for providing services like in the hospital, in the bank, to any places where are requested by the deaf. And we also have the disability pension just now, right? You mentioned about the allowance, and also the allowance, the pension. Of course, any registered disabled people here, they are eligible to get like at least 800 baht per month, up to 1,000 baht, depending on their eligibility. For example, for those who are like 0 to 18 years, they get like 1,000 baht, and with the same rate as for those who have like the registered as like very in the poverty, you know, we have those list of people as well. And now we are working on increasing the allowance for them, and which is again in the cabinet to be considered. Okay, and we also have this, that is the pension. We also have like allowance, like the emergency, in case of an emergency, up to 3,000 baht 4 times per year, right? In case of any emergency or any in very poverty level. So these are the different criteria. And we also provide a legal assistance for those who are, for example, there are lots of people with disabilities who are treated unfair, like they encounter discrimination in society. They can come to us to get asked for the legal assistance, legal consultants, and sometimes with the fee, sometimes with the court, right? In case that they need to go to the court. They of course come with some expenses. We support for that, but of course it need to be getting into our committee. And we provide the personal assistant and with the housing renovation services. And to work with other agencies for promoting the accessible environment as well. So these are some of the examples of our service provisions. And here, next is the projects, like a foster family projects. We initiated like for a couple of years ago, and it's getting more popular because we want, as the government policy, wanting to get back the people with disabilities into that local community. We want the real inclusive society, right? So we support with some of the financial support to the family who are ready. That of course they need to testify, they need to verify that they are ready to take care of person with disabilities. Can be their own family, or with their friends, or with their with anyone who are ready to live or to take care of this group of people. And of course, we have a certain criteria thinking about the safety nets, about their well-being, and etc. Okay, and that is the way that to reduce the people in our institution as well. Okay, and here's the detailed of the housing renovation. Of course, we provide 40,000 baht as a maximum per time as requested, right? And these are some sort of the criteria that they need to stay at least or that house for 6 months, right? And it need to be this need to be submitted, right, to the committee, of course. So thinking about the needs, right, because particular types, particular individuals are having the different needs. And of course, with the social background, right, about the socio-economic backgrounds as well. The next one is about the personal assistant, or PA. The objectives of this PA, right, is to enable, to facilitate the group of people with disabilities to have the free and to live independently in the society, like especially who have like the severe disabilities, right? Of course, they need some certain help, and we also have like, it's similar to the in sign language interpreter. We have a pool of the PA, of course, need to be trained, and they are certified by the department. And now we have around 2,000 like people, which of course the needed is over like 7,000 of people. Of course, it's not enough. Now we are working with the universities. Universities are the educational institutions just to train. We have a national curriculum, like to train these PA, so we can keep them like standardized the PA's quality. And so we dispatch the PA throughout the country through our disability service centers. Remember, we as a mechanism to help us to work in the local community. And of course, the PA can work like 6 hours per day, and the wage, the minimum, the rate is paid up now. We have been recently increased the rate up to 60 baht per hour, right? So that in 1 month they can work like up to a certain rate of hours, right? And of course, each individual or person with disabilities, they can submit the requirement for the PA so that they can get to a certain amount of the hours per month that they can get the PA. And just now, remember, for those who don't want to pay, they don't want to hire, they have to pay, and the money gets to the debt fund. And this fund have the many objectives, right? The way that they can pay the money, they can pay the money to have the projects with the OPD, organization of person with disabilities, like to work together, or they can provide the loan, the loan services without any interest for the first 5 years. There are two modes of options. First, as the individual loan up to from 60,000 to 120,000 baht. And this isn't for individual loaning, but for the group loaning, of course, they can pair with as a group, right? Register like the cooperative, right? In their community, they can come together and they can get the loan. And of course, there are certain criteria or eligibility of person who get the loan. They have to have the business model plan, right? Business model to be shown. They have to pay they have to show that they have some certain skills, right? They have to show that they are reliable for the to be able to pay back the money. Okay, so these are to support them. And these are some of the successful stories, right? And person with the hearing disabilities, for example, they are hired as in the like the big C shopping mall, okay? And of course, the other position within the senior painting officer in the Toyota Next company, you know, the locomotive company. So these are some of the successful stories, like from the promotion of employment of person with disabilities. Not only they get the job, they can get even the decent job, right? They can get promoted, they can get the wage, the salary that can be increased, etc. These are some of the examples of the successful stories from those who get the loan from our fund, right, from the debt fund. And sorry, due to the time constraints, maybe you can get to play the video clip on your own after the slide has been distributed from this session. And this is from they get the loan, they get the money to open the shop, okay, and they can grow vegetables. And these are the careers that they can earn their livings, right? And of course, when we work, there are national mechanisms in order to that we can implement, right, from the policy translated to the real implementation. Of course, we have the National Committee on Employment of Persons with Disabilities, which shared by our Prime Minister. We have like worked with many ministers, ministries, right? And like ministries of Ministry of Labor, Ministry of Public Health, Ministry of Education, etc. In order, as I said, we cannot work alone. And also there are representatives of national OPDs in this board, national board as well as the experts in disabilities areas, right? And we also, apart from the national committee, we also have the subcommittee on empowerment of persons with disabilities in every province as a provincial levels, right? So that they can work. We, as I say, we try to decentralize the power to the local community. And apart from this, we have the other subcommittees working under the national board as well, like the subcommittee on each particular disabilities. Of course, they have their own particular types, they have own particular needs, and particular areas like on entrepreneur, right, to support the environment, committee on medication and medical care, etc. And also we have the subcommittee on the debt fund as well, right? Just now I mentioned about the debt fund. And these are our mechanism to make all of this policy to translate that the rights of people with disabilities become real. So these are some of the examples of the social protection scheme in Thailand. Thank you so much.
Thanks so much, Nantan, for your presentation. It was really great to hear from you about the amazing work that's happening in Thailand to support people with disabilities. We're moving now to a very different context, and I'd like to welcome our next guest speaker, Faatino from Samoa. Over to you, Faatino. Thanks so much.
Esteemed panelists.
Your slides are up and ready to go.
Okay, thank you. Esteemed panelists, colleagues, ladies and gentlemen, thank you for allowing Samoa to share its experience in the area of social protection and inclusive services through NOLA, who is the National Advocacy Organization of Persons with Disabilities. Next slide. So by way of introduction, the mandate of NOLA, or the National Advocacy Organization of Persons with Disabilities, is to enhance rights, ensure dignity and inclusivity of persons with disabilities by advocating as the voice to bridge the gap between the government, persons with disabilities themselves, as well as the wider community. And indeed, one of our biggest focus is advocacy for social protection and inclusive services. Next. So I believe the 6 preconditions to inclusion came after we advocated for social protection program for persons with disabilities. However, throughout our advocacy as the Organization of Persons with Disabilities, we have been implementing its principle on a day-to-day basis. For instance, whenever we advocate, we ensure that the legal policies underpinning programs, including social protections programs, are in line with the International Convention on the Rights of Persons with Disabilities, which Samoa is committed to in 2016. When we advocate, we ensure that the governing structure of programs and services are inclusive by having a person with a disability to sit and represent us at the highest governing level, both to provide advice and to monitor progress of programs. When we raise awareness to ensure that the mindsets of individuals, including decision makers, perceive persons with disabilities positively, seeing them as people who can be beneficiaries, at the same time provide decisions. When we advocate for programs, we advocate for programs who are provided with financial support, as we believe that it is only then that we ensure sustainability and full inclusion of persons with disabilities. We provide data on the barriers faced by persons with disabilities, their current situation, as well as the solutions. Then, to top it all, we build the capacity of persons with disabilities through our affiliates to ensure that when they call to meetings or when they advocate for social protection programs, they are able to contribute effectively in changing the narratives as to how these inclusive programs are designed. Next. How else do we do our work? Well, as a member of the Pacific Facilitators of Persons with Disabilities, as a member of the Pacific Facilitators on the International Convention on the Rights of Persons with Disabilities, we use to the greatest extent the opportunities which come with these trainings, to share to government, to provide them with advice, and to ensure that the rights of persons with disabilities are included and considered in their programs. As a member of the treaty body mechanism, this was established by government and comprised of the heads of government ministries as well as CSOs to monitor the progress of recommendations of the treaties which Samoa are party of and provide reports. We use this as well as a mechanism to advocate for the inclusion of recommendations pertaining to persons with disabilities. And then we use the opportunity given to us to contribute to various policy discussions to bring to light the rights of persons with disabilities, the challenges, and what it's like to be supported, both financially, technically, as well as other areas of life. Then we use our lived experience as persons with disabilities to contribute and to fill in the gaps in which governments are missing. Through this, we advocate to ensure that the commitments in which governments are making to persons with disabilities, for instance, are translated into action. Next. So here are some of the successes. I realize that there is no way in which we can compare to countries like Thailand, in which there is a lot of resources and that the capacity of the population is far too bigger than us. But allow me to share with you some of the successes of the work that we are doing as the National Advocacy Organization of Persons with Disabilities. Through our sustained advocacy and through our contribution in the national and regional reports, which are applicated of Samoa, we have been able to work alongside with governments on disability-related policies, for instance, the National Policy on Inclusive Education, the National Policy on Persons with Disabilities, the amended Act on Social Protection, as well as the ongoing recognition of persons with disabilities through our organization to contribute in the development of policies, in the development of programs, and in the implementation of national ethics. Both as advice, both to provide advice and as beneficiaries. Through this sustained advocacy, government since 2017 then began to take the necessary steps towards establishing a national social protection program for persons with disabilities, in which the rollout started in 2021. Next. In any program, there are challenges. And for us, in terms of the advocacy work we do, at this point in time, we have been experiencing a lot of budget cuts with the political situation and many other issues. Disability services are now limited. Because some of these social protection programs, for instance, the support provided to inclusive education, have always been relying heavily on donor funded. For instance, the budget supports by DFAC So now when these budget supports are finishing, the support for inclusive education is now stopped. There is always a huge disconnect between what is written on policy, or between what is written and committed to in terms of social protection programs and the practice. Community services are underdeveloped because there is very limited resources. There is exclusion of service providers who are providing support to persons with disabilities under these social protection mechanisms. Their salaries are not paid because of the many constraints. Next. In terms of the barriers, gaps, and opportunities, as we all know, despite the barriers, there are also opportunities to improve. For us, as I said, because of the challenges I've highlighted, the coverage of social protection is very weak. And because our social protection program, despite it is a step in the right direction, it is only a cash in a form of a cash allowance. And because of this, it's not encompassing the other related costs by persons with disabilities to ensure their inclusion. For instance, the provision of assistive devices, the provision of medical supplies, to name a few. And because of the constraints I mentioned earlier, children with disabilities, for instance, are not receiving the right support. There is limited data, and there are very limited opportunity for integration. However, we see that because our own government is going towards strengthening district and community level plans. So we see this as an opportunity to integrate social protection mechanisms for persons with disabilities into the support that is going to the districts. We see also with the upcoming election, whichever the party will win, we see this as an opportunity also to lobby inclusively to ensure that the bond between government, persons with disabilities through the organizations they represent, and the service providers are strengthened. Next. We believe in terms of social protection, we believe that the cash allowance is welcome, but it should not replace the community and care support that we are receiving by our families and friends. It should complement but not replace. We agree and appreciate that the cash allowance contributes to our inclusive, it contributes to our recognition, and it contributes to our independence. But we believe that giving us the cash allowance is not going to be enough considering the cost to our inclusion. Next. Well, in terms of way forward, considering everything I shared, we believe that Strengthening partnership between governments, organizations of persons with disabilities will be a good way forward in improving access to inclusive services and social protection for persons with disabilities. Ensuring that social protection mechanisms which are developed for persons with disabilities should be at the center of it all, and that these programs are sustainable by providing financial support and technical support from government domestic resources. We recognize also the significance of investing in community support services as a way to strengthen inclusion and to improve access to social protection. Position persons with disabilities through the organizations they represent, both as beneficiaries and decision makers. Lastly, but not the least, social protection in the view of NOLA, and I'm sure persons with disabilities agree that social protection is not charity. It's justice, dignity, and inclusion. And persons with disabilities, through the organization we represent, remain committed to ensure we advocate inclusively to leave no person with a disability in Samoa behind. I thank you.
Thank you so much, Faatino, for your presentation. It was really great to hear from you, and we have two very different contexts here that we've been hearing from our guest speakers. Very different contexts, both population-wise, but also with the context in place. I really value hearing your views on this discussion from the OPD perspective, Faatino. Very great to have you join the discussion. And thank you also to Nanatut for giving us the perspective of the Thai government on the schemes that are in place there. We'll open the floor now to questions. We do have a couple in the Q&A box. So we'll get started with those. We've just got a few minutes here for questions. The first one is to Nantanut about the disability card as the key document to access different services. The question is, how do persons with disabilities register outside of hospitals? And is there a system to ensure that communities are encouraged to register their members with disabilities? Some families, out of stigma, might hide their family members with disability and hence prevent them from accessing any support. So wondering how you get around these kind of challenges with making sure that registration for the disability card and then the services is being managed. Over to you, Nantanut, on that question. We might go to another question while we're just waiting for Nantanut to come back online. I was wondering as well, maybe we can hear from Alex and Charles here. We've got another question online about what would you recommend that governments should really be sort of earmarking as a minimum for disability inclusion expenditure? And one of the questions that we've had coming up a couple of times is, and it obviously dependent on the context, but are you seeing that having that kind of pooled funding for disability that governments can access is a better way forward? Or is it better to have a coordination mechanism such as we have heard that Nantanut has been a part of developing in Thailand, where government ministries are all kind of coming together, and what that might look like? Over to you, Alex and Charles, on that.
Thank you very much. I think first, I think it's fair to say, and Charles, please elaborate further on this. It's not like we've seen in low and middle income countries very successful disability funds with scale. But I think what's really important is that it's not a either or question, it's an and. That we need strong coordination mechanism. This is very clear. And I didn't mention that, but in the Global Disability Inclusion Report, there is a whole section in chapter 2 that look at, with a whole study that was done by the University of Galloway, looking at progress in terms of national coordination mechanism, which I think can be useful with some interesting findings. I think that there is so much more that we can do to ensure mainstreaming of disability-related expenditure in different sectors. And there is a question on what practically does that mean. And I think that what we've seen in different countries is pieces of what is needed, but not necessarily all of it together. For instance, if you look at India and the Philippines, years ago, there was earmarking a certain percentage of budget of each agencies, public ministries, was supposed to be dedicated to disability inclusion. But when OPDs tried to assess, they could see that except education, health, and social protection, there was little expenditure. And when they asked questions with right to information request to the different ministries in India, for instance, one of the answers that came repeatedly was, it was not clear what we were supposed to do. And I think that you can ask ministries, or you can mandate in a public finance law earmarking of a certain or ring fencing of a certain share of a government agency's budget for disability, but there is no specific action plan for this ministry. If there has not been training of decision maker and frontline workers on disability inclusion and what that means specifically for their work, then they will not be able to action and spend this money in a way that is meaningful. So it's not just the public financial management system that needs to kick in terms of being disability inclusive. We can talk also about procurement mechanism that needs to be more having accessibility requirements, for instance. It's also the whole mainstreaming within ministries with focal points, with training of staff, developing specific action plan. So I think what Charles was mentioning with the work that was done, for instance, in Mauritania, but also in other countries, on costed action plan of national disability strategy with sectoral components, where there is an ownership of the different ministries about what they are supposed to be doing and how they will be doing that. So it's beyond legislation. It's really how you articulate those elements. I think that is really, really important. I don't know, Charles, if you want to add anything on this, the scale of the funds that we've seen so far.
Yeah, I think I would just say, yeah, a key thing to highlight is in the countries that we looked at, and we looked in quite a number of countries, the funds tend to be quite small. So there is another chart we have that shows if we take that 0.1% of GDP, which we see as a kind of benchmark from a minimum package, of all of the funds we looked at, they are only a small portion of that. And so even in countries with funds, they tend to be a part of expenditure. So Thailand, for example, does have a disability fund, but the expenditure on the cash transfer, on the healthcare elements, on the Department of Empowerment of Persons with Disabilities, they don't happen via the fund, they happen separately. I would also highlight that, often you see in disability legislation, a fund is established and there is maybe quite a long list of sources of funding, donations, interest on investment, maybe some other kind of earmarking. In reality, a lot of the funds are simply based on an allocation from the government budget. And in which case it slightly raises the question, well, what is the added value if this is just another budget line with money being allocated? However, there are some countries that have earmarking. The clearest example of that is countries with employment quota systems, where businesses are fined if they don't meet the employment quota. And Thailand is another good example of this. The fund is primarily financed from the fines of that employment quota, but that exists in quite a number of countries. So I think, yeah, the first point is to highlight these. I mean, experience would suggest these funds are part of the picture. So I think thinking what is the added value, what are they catalyzing, what can they do in addition is really key. And I think the other lesson is these are likely to work better when there is some kind of distinct source of funding. Simply saying we will set up a fund, we hope people will contribute. In the end, you know, we hope there'll be donations. Maybe there will. We don't see clear indications of that. I think that is likely to be less successful, where you say, okay, well, we have this, at least one source of funding that we're really going to earmark, and that's going to be the core funds that it relies on.
Thanks, Alex and Charles. There was just a little follow-on question to the financing story. Someone noted in your slides that social protection does look like the bulk of government spending for you know, supporting people with disabilities. The question was, where are we seeing the real gaps? Like, what sort of sectoral areas are you seeing the sort of funding gaps for supporting persons with disabilities?
All the rest.
Yeah.
I think there are different things that we need to be clear. Is that it's normal that social protection represents a bigger bulk of disability-related expenditure. Individual support will always cost more money than mainstream support. That's normal, and we see it in OECD countries. I think it's important. We don't expect all ministries to spend 0.5% of GDP on disability. That's not the way. But what is more concerning is the fact that sometimes, because there is the expenditure on the cash transfer, the government has a sense that job has been done. And that, for instance, there is no clear scale up on assistive technology, the whole work on care and support system, human assistance, but also really mainstreaming, really making sure that transportation systems are inclusive and accessible, overall infrastructure, economic development and labor policies. And this is the challenge we faced, is that, as Charles was saying, it's not easy to track expenditures when they are mainstream. But what we saw also in countries where we've been going in depth, or where OPDs have been going in depth, is when you look at regulation, in many of those programs, there is no clear provision for the public sector to make its work inclusive and accessible. So it's very unlikely that there will be expenditure. So I would say it's hard to pinpoint the sectors where there is really lack, but it's more about the machinery of making mainstream services really inclusive for persons with disability, and resourcing this inclusion that we see missing in most sectors. Obviously, you will find education and health in most countries with having some provision, but if you look at justice, for instance, it's very hard to find the resource that would be needed to actually provide decent procedural accommodation for persons with disabilities. But we really encourage everybody in the webinar, start looking in budget, start tracking disability expenditure. Very few countries have a clear idea of how much they spend and where they spend money for persons with disabilities. And the last point for me is, if you want to know the gap, you need to know how much you need. And this is something that Charles really insisted on. We found very little evidence on costing of interventions. Over.
It's very interesting. Unfortunately, we've run out of time to have any more questions, but we're hoping to dive a bit deeper into a lot of these issues in a webinar series next year, where we are going to, you know, do a deep dive in some of these issues that are of interest. So after you log off, you will receive a link to fill in a survey, and we'd love to hear from you. Great to hear about the issues that you would really like to know more about, so that we can start thinking about how we manage those. I would really like to give a big thank you to our guest speakers and our SP.org team, who have been working hard behind the scenes, and our sign language interpreters. It's been a great time for a lot of us joining online, so I really appreciate you joining us. Our guest speakers have shared some amazing insights, and we didn't get to have a lot of question and answers, but if there are any other ones that you would like us to answer offline, please do get in touch. We've got the next webinar in this series on the 18th of September. Again, a UNICEF DFAT partnership on gender responsive social protection. Again, thanks a lot to our guest speakers, and thanks for joining. And the recording will be up online tomorrow. Have a good night, everyone. Thank you.